Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to this episode of Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Sarah Shaw, Associate Director of Diversity, Equity and Inclusion and Community Outreach at the Global Healthy Living Foundation. I have been living with chronic migraine for almost 10 years, and I'm very open about navigating life with my chronic disease journey, as well as my experience living with anxiety. This podcast will be a window into other patients' lives as they navigate their own journeys living with chronic pain, migraine, and mental health. Today, we're joined by Chandler, a chronic pain recovery coach who also has lived with chronic migraine and cluster headaches. Chandler, welcome to the Talking Head Pain podcast.
Thank you. I'm happy to be here.
I'm really excited to dig into the discussion today, but I like to start off each episode asking people if there was one word you could use to describe your migraine or head pain issues, what would it be?
My word would be inconsiderate. Very inconsiderate.
I like that. They're so rude, right?
They're so rude.
It's like you could just be minding your own business and it's just like, not today. And it'll just like barge in, like without even an invitation.
Exactly. Like any future plans you have are just up in the air. You never know what's going to hit you.
Yeah, so true. And while we're on the topic of the inconvenient and rude migraine and head pain, I know from our last discussion, you mentioned that you live with both chronic migraine and cluster headache attacks. What has been like one of the worst attacks that you've had? Can you just describe for people who maybe aren't really sure what that is or how it affects you?
Yeah, so my worst attack was actually my very first one. So in 2020, I was woken up out of my sleep by the most severe pain, which at the time I didn't know what it was, but it actually was a hemiplegic migraine. So I experienced temporary paralysis and I just lost all control of my body. I had severe head, face, and neck pain. And then from then on, I experienced a cluster headache attack every single night for about 2 weeks. It would come at the exact same time every night, 4 a.m. And from then on, I experienced 24/7 head pain and face pain and neck pain and was diagnosed with chronic migraine and cluster headache attacks.
Oh my gosh. I'm sure that must have been incredibly scary the first time that those attacks happened. And did you even know what was going on at the time?
I honestly thought I was having a stroke.
Oh my gosh.
That's how bad it was. I couldn't really speak. I couldn't really see. And of course, I had paralysis. I just didn't know what was going on. And I actually had been working with ear, nose, and throat doctor because I had some sinus issues. And he had thrown out the idea of migraine that I could be experiencing instead of sinus pressure. And I just thought, well, there's no way. There's no way I'm having a migraine attack. I had never had one before. So then when this intense attack happened, I was like, okay, maybe this actually is migraine.
Right. I'm seeing it a lot more now, but in terms of the different variety, that's not like the right word that I want to use, but the different types of migraine, you mentioned hemiplegic. I'm seeing more information now than I did, even like 4 years ago, like when you said you were experiencing that, like I had only started really knowing about hemiplegic and vestibular migraine attacks only a few years ago. And so for your ENT, ear, nose, and throat doctor to kind of be in tune with that is really spectacular and amazing. And kudos to them for leading you into kind of the right avenue of the language of what it is and to see a specialist to get better care or to get more care. I went through something a little similar. It wasn't an ear, nose, and throat doctor. It was a pharmacist, actually, where a primary doctor was saying it was stress, it was anxiety. The word migraine never came up when I would go to them talking about my symptoms, the nausea, the light sensitivity, the temporary blindness in my eye. And they were like, it's just stress. You're just stressed at work. And I had the head pain. And so I was in a pharmacy just looking at the over-the-counter medications, thinking like I have head pain, but I wasn't thinking about the nausea. And I just went over to the help section. I was like, hi, like, do you think this like will help whatever I'm feeling? And she was like, well, what are you feeling? And I said, well, my stomach hurts and it's really bright. And she was like, okay, I actually think it sounds like you're experiencing like that's light sensitivity and nausea. And once she said the word nausea and light sensitivity. And she was like, it sounds like a migraine attack. I can't diagnose you, but you should see a neurologist.
Wow.
That was the bridge, I should say, the bridge to get me over to better care. And it sounds like there's a lot more education that needs to be out there. You went to your ENT, a pharmacist kind of diagnosed me. Like, it sounds like there's a lot of access issues and people falling through the cracks who don't know what it is that they're experiencing.
Definitely.
I'm going to get to this a little bit later on since it's minority/BIPOC Mental Health Awareness Month, but I was having a conversation the other day with another friend who lives with chronic migraine and mental health CPTSD, and we were talking about how a lot of people with invisible illnesses, especially women, right? More non-binary people, it's all in your head. It's all in your head. Like, you know, it reminds me back to when, I don't even know how far back that dates. I think I saw something as terms of like BC, hysteria. Like women were diagnosed with hysteria for things that were going on in their body that were actually very real. But because no one had studied the female body, that there was just not a lot of diagnosis or treatments for these things. And I was thinking about this and reflecting it about how all in your head for so many years, people who have difficulties getting diagnosis are told that. But then I kind of want to have like a reclaim your moment of actually it is in your head. And this kind of probably goes into like the mind body syndrome that you focus on and you specialize in, about how it actually is in your head. Chronic migraine is like literally in your brain, right? The pain is coming from there, and then your brain is telling your stomach not to do these things. Anyway, I want to know your thoughts on the it's all in your head, when actually it is all in our heads, but not in a dismissive way like we've been told.
Right, not in that way. Yeah, I actually love that, reclaiming that it's in your head, because I feel like people that deal with chronic pain and chronic illness are constantly invalidated. So we naturally get this defensiveness when someone brings up a mind-body connection, because so many times when doctors bring that up, they just want to write it off as stress or anxiety. But when we think of the mind-body connection, we have to think about the way that the brain and the body are connected. So the brain sends these signals to the body. And it doesn't mean when we say the brain, we're just saying just a mental health issue like anxiety or depression. We're even saying like a physiological process of the brain sending a signal to the body. So when we say it's all in our heads, we can say something like, we feel it in our body, but the solution is in our head, or the solution is in our brain, instead of thinking of it as it's just all in our head like we're making it up. But we can look to our heads, look to our brains to get to a solution.
Right. And you've been really working in mind-body syndrome for a while now. How has that impacted your own chronic illness journey? And if you don't mind digging into a little bit deeper about mind-body syndrome connection.
Yeah. So throughout my chronic migraine journey, I had so many other diagnoses piled on. Like you mentioned, vestibular migraine. I ended up having that diagnosis piled on. I dealt with fibromyalgia, IBS, huge list. We would be here forever if we talked about every diagnosis and symptom that I had. And throughout all of my treatments, my medications, nothing really gave me long-term results. I was previously working as an associate marriage and family therapist, and I had to leave my job and go on disability leave. And I just was in 24/7 pain. So if that gives you an idea of where I was at on my journey, and what really gave me long-term results and actually gave me my life back to the point where I don't experience chronic symptoms anymore. I haven't had a migraine attack in years, is focusing on the mind-body connection. So for my journey, that's really what has been a game changer for me. So basically this led me to become a mind-body syndrome practitioner. And mind-body syndrome, which is also known as neuroplastic pain, you might be hearing neuroplastic pain online, but it's basically when the brain misfires pain signals when there's no structural cause in the body for pain, or when that structural injury has healed, or when, say, that first migraine attack that you ever have is over. The brain remembers that process. So anything that it feels like could be off in your body or off in your external environment, so say things that are keeping you on alert, it will continue to send that pain signal because it thinks that you're in danger. So working from a lens of mind-body syndrome or neuroplastic pain actually helps you focus on the brain instead of trying to fix something in your structural body.
Wow. I go to therapy.
Same.
And we talk a lot about trauma. And I've heard a lot of other my friends who are very invested in therapy and mental health wellness A lot of things that I've heard are actually about EMDR, also known as eye movement desensitization and reprocessing. And what that does is it kind of creates new pathways, right, for your brain to deal with current events that are happening that may have pathways in the past that you have been prone to react from. Like for me, I unfortunately come from a lot of trauma and a lot of experiences. And so something that will happen to me, like if somebody will send me a message saying like, hey, I'll immediately get like anxiety of like, oh no, I'm in trouble. I'm doing this thing. And so working on that in therapy has like really helped me get out of that flight mode that like my brain and body, I'm an anxious girly. It's going to happen, but it's allowed me to at least break out in sweats and not, like full on panic and stare at my computer screen for like 20 minutes because I can't move from that fear. And so it sounds like a lot. And obviously I'm also too on medication, right? So for every body is literally different. Like what works for some people might not work for somebody else, but I love that there's this option out here for people who are, maybe on medication, but like not getting the exact results that they need, that they can combine, right? Holistic medication and this mind-body syndrome practicing into their toolkit if it helps them. I'm always someone who's like, I'll try it. Please just give me something to try it because like being in pain sucks. Like it sucks. It's a drainer. It's a lurker. So any way that we can figure out ways to make our bodies be in less pain, which is also trauma, like the being in pain, you said 24/7, like that is so draining and actually like kind of leads me into like, we're talking about mental health. We're talking about it being BIPOC Mental Health Awareness Month. How does mental health play into your life with chronic illness, chronic pain, or just pain in general?
Sometimes I think of it as a chicken and an egg situation, like which came first. So many people that deal with chronic pain and chronic illness had mental health issues beforehand. And then some people, their mental health issues started after the pain and illness because the pain is so intense. It becomes part of your identity. It takes over your entire life. So it's so important to focus on mental health when you're dealing with pain, because if you don't deal with that, both of them are just going to worsen. And I like what you said about your practice with EMDR. The subconscious mind remembers what the conscious mind forgets. So there might be so many triggers that you have that you don't actually realize because you haven't worked through them, you haven't noticed patterns. So if we can tap into looking at our mental health and how we emotionally respond to our physical pain, how we emotionally respond to things in our environment, this can actually help us decrease the pain symptoms that we're experiencing.
No, that's a really good point. I think I've always live with mental health issues, but I've noticed that they exacerbated when my migraine attacks went from being just episodic to chronic, right? Like in the beginning, it was like maybe 3 or 5 a month. And to me at that time, that was the most horrible thing to happen. Like I couldn't go to work, but it was only looking back now, I'm like, it was only 5 days. Like it was only 3 days that like I wasn't in. Up until 2 years ago, I was having migraine attacks 20 to 25 days every single month. And I know that I became more incredibly anxious. I became more stressed. I became depressed even, where you're in a system, your body's in a system of just constantly being in pain. And at the time, for me, there was no hope. I had been through a lot of the medications that were out there and none of them were working for me. Even my old doctors were stumped and they even like went as far as called me a problem patient when like that's also not the right language to use. It's not that she said, oh, well, you failed the medication. No, it's not. The medication failed you and we need to keep working at finding a way to get you back to baseline. And now, thankfully, 2 years later, I am on better treatment. I am managing my symptoms so much better. And I do know that having a therapist that validates not only my mental health, but my chronic illness. Like I've been with people who downplay chronic illness and like, oh, it's not that bad, or why don't you RSVP to things? Like you should just go and push through it. And it's like, that's making me feel like less than a member of society. And I hear it a lot in the chronic illness community. And I think now we're talking about comorbidities, mental health is coming up a lot. And I just really wanted it to take a moment to talk about it during such a important month where we don't talk about mental health as Black, Indigenous, or people of color, right? Like,
right.
I want us to to be open and feel like it's okay. And if I'm the person and you and I are the people that are the ones breaking the silence and helping more people come forward to talk about mental health comes along with living with chronic illness and chronic pain, that's okay. So
Yeah.
I appreciate this topic. And speaking of like, I know that you said you're doing so much better now and I'm thrilled. Like I'm so happy. And, we talk about like remission and we talk about, getting back to baseline. That is always my thing. Because I think for me, and maybe this is not the right way to think, part of me is like, I'm just may always have this, but if I can manage it to where it gets back to that level of less pain during like 2 days a month, 3 days a month, like that's a win. That's a goal for me. But when you did have those difficult days, what did you do for you to kind of like self-care, make sure you're taking care of you, community care? What sort of tips can you share with our listeners that they may be able to utilize?
On those days, I feel like I had to really challenge myself to not try to be productive. Like there were so many times where I just wanted to, quote, push through. And I had to really just let myself say, okay, it's okay to lay down, curl up with a blanket, eat some ice cream. Like I would usually go get like a Coca-Cola. Like I don't know why McDonald's Coke hits different.
It does. No, they do something with that syrup. I'm telling you.
Yeah, I feel like they're putting like something in it. Like it's like the carbonation hits different. So I would let myself do that. If I was able to walk, I would walk, get outside in nature. For some reason, that was just my time to just like completely zone out. And for some reason, that would just make me feel better. And then also, I would love to just curl up on the couch with my husband, watch some reality TV, and just let myself not be productive. There are so many times where I felt guilty for not being able to work. And I had to just let myself be and remind myself I was doing the best that I could. So if the best I could do is a McDonald's Coke and some ice cream and some reality TV, I think that's what I'm going to do, and just not put pressure on myself to like do more than I'm capable of in that moment.
Snaps to that, like seriously. And that is a really hard cycle to break. I feel like, especially like as Black people, Black women, like there is this unspoken pressure. I think that we always have to be productive. We always have to be not taken the wrong way, not come across as aggressive or strong. This whole trope, honestly, of the strong Black women, like I would like to retire that and like be like the rested, relaxed, the rested, relaxed Black woman, please. Can we have that? But no, what you're saying, Chandler, is so important. And it took me a really long time to realize that you cannot pour from an empty cup. Like if you are flaring, if you are struggling with your mental health, like you have to, what's that saying? You put on your own life vest before you put on someone else's. You have to take a step back and take care of you. And also, I'm stubborn. It took me a while to like allow help from my partner. Like she was always there being like, what can I do? I'm like, nothing. You can't do anything. This is all on me. It took me up until a few years ago to be like, actually, can you like go get me my medicine, please? Like for me, that felt like such like a huge ask. And she was like, of course. So just being able to, be in tune with your body, to know when you can do things, when you need to take a step back, I think is so important, especially when you're getting flares from all angles, from actual pain to nausea to, like you said, your stroke-like symptoms. Like no one would expect someone with a stroke to come to work.
Exactly.
Taking that pressure off of our shoulders and backs, I think, is important. So I'm hoping this conversation lets someone else out there know it's okay. Sit down, unclench your jaw, lower your shoulders. It's gonna be okay. And we have people like Chandler out there to kind of help you navigate through that. So I just want to thank you for coming on the show today. I appreciate you sharing your tips, letting us learn about something that I just only discovered a couple weeks ago through you. And it's so important. So Chandler, thank you so much for coming on.
Thank you so much.
Thank you for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. If you like this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing with your friends and family. It'll help more people like you find us. I'm Sarah Shaw, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.